Hello friends. Many of the patients in your clinic or OPDs, they come with typical body language and you always try to find out like what is different and what is the rubric in this particular body language. So a few of the examples I would like to put forward and share and the rubrics which I have found. So this patient, this young man, he came with a complaint of fever, and I asked him like, "What is your problem?" So the reaction of this patient was like this, as if he is asking me to repeat again. So his father was standing nearby. He said that doctor is asking how are you and what is your problem. So he said he's having fever and blah blah blah. Then again, I fired another question. So again, he did like this. His father was able to understand, but this guy was not able to understand, even because this guy was standing in nearly in front of me, and the father was still far behind. So from that distance, also he was able to hear, but this patient was not able to hear. So here, the rubric which I found was absent-minded, spoken to win. Okay. So this guy, he is like absent-minded. When he is there in the clinic, there should be some kind of alertness, but that alertness was not there. So this is absent-minded, spoken to when. Parallelly, another rubric which you can think of is unobserving, inattentive, spoken to when. Okay. So this is another parallel rubric which you can think. Then answering, reflecting long. Answering, reflecting long means if you fire a question, patient will think and then he will answer. So many of the Barytas, they have this particular body language and they behave like this. And many of the Barytas, they tend to come with some or the other person. So this 25-30-year-old man, he came with his father. So another rubric is dependent of others. So there is quite a dependency in Barytas. Then another lady, she came for some complaint. She was looking like 30-35, and I got surprised when I asked her, "How are you?" And the tone of her voice was like as if some girl or a child was talking. So this was very important for me, and I prescribed on this. So this is either could be identity error, or number two, childish behavior and only the body grows. So this is the rubric. So the rubric which I took was childish behavior and only the body grows. So I gave her Baryta. Okay. Then many of the Barytas, they come to you and in the conversation they tend to laugh. And even if you stop, the other person, he tend to laugh for a long time. So the rubric here is laughing immoderately. So you can use this. Many of the people, you might have noticed that on a joke they tend to laugh and laugh and laugh. So the duration is more. So this is laughing immoderately. So Baryta is one medicine in that. So you can have an idea. Then yes, one girl, she came with dysmenorrhea, and she said that during this pain, I am having this severe pain and I'm not able to do anything. Uh, when there is pain, I am not able to decide whether I should rest, whether I should uh, take care of this pain, whether I should study or what should I do. Even this pain came last year when I was having this exam. So during that exam, this girl was not able to write that paper very properly because she got confused what to write and what not to write because of this pain. So this pain disturbed her mental faculty. So the rubric which I took here was confusion of mind, paroxysm of pain, with. So here, during the paroxysm of pain, this patient's mental faculty is in a state of confusion. So here, because this lady was having scanty, or the girl was having scanty menses, I ruled out chamomilla and aconite, and I prescribed her dulcamara. So this was the prescription. So friends, do not be afraid. Whenever there is a patient coming, he will act, and that particular drama you have to observe and you have to form a rubric. So homeopathy is a personalized system of treatment. So we have to observe each and every person as an individual and try to prescribe a very accurate remedy based on very accurate rubric. So friends, thank you. Please like and subscribe and share. Thank you all.